Good afternoon. My name is Jen Schmitz, and I am the Chief Operating Officer at Covenant Place in the Mirowitz Center. And on behalf of the Mirowitz Center, I want to welcome all of you today and encourage you to check out the Mirowitz Center's Facebook and e-blast.
Mark, come here a minute.
Many details about other Zoom programs. Today's presentation on the COVID vaccine and myth busting is enormously important as new strains mutate and our lives are disrupted by heightened travel restrictions and continued isolation from family and friends. With so much information and misinformation around, we at the Mirowitz Center are honored to welcome our friend, Dr. David Carr, the Alan A. and Edith Wolf Professor of Geriatric Medicine and the Clinical Director, Division of Geriatrics and Nutritional Science at Washington School of Medicine in St. Louis. I'm also delighted to introduce my dear friend, Dr. Sharon Vermont.
Jen, you're muted.
What part did it go mute?
You just said my name and then you went muted.
Okay, so I am also delighted to introduce my dear friend, Dr. Sharon Vermont. Sharon is a participant in the Moderna trial and will share her personal experiences. And with that, I will turn it over to Dr. Carr. Thank you.
Great. Hello, everybody. Wonderful to be here and excited about this topic. Although I've had some personal experience with the vaccine, and I have also been involved in some of its distribution. I do think from our standpoint that there's so much still to learn, a lot of answers we don't have. Many of you have been reading voraciously and probably will have some great information to share. So I'd like, first off, to confirm that you can hear me and you can see my first slide, the COVID vaccine myth busting. Is that maybe a quick show of hands if you can see that and hear me? All right, so we'll move on. I always want to make sure I put out some disclosures here. I don't think there's any conflicts of interest per se, but I wanted to be sure people were aware of funding. So we have some time this next hour, and I would probably maybe have a half hour to 45 minutes prepared. It usually ends up being longer than that because I get a little gabby, but we're going to have plenty of time at the end for some questions. First off, I've reviewed a lot of videos on taking the vaccine, and you probably have too. And I actually had one shared to me by my uncle's cousin. And to me, it's actually the best one I've seen out there when it comes to looking at the data. So I want to start out showing the video, and I hesitate a little bit because it kind of reminds me of being the substitute teacher in science class that comes in and shows a movie, you know, and it's like, puts everybody to sleep. But I think you'll enjoy this. If you've seen it, I think it'd be worth seeing again. But it really gets down into the risk-benefit ratio. And then we'll hear a little bit from our guest physician, Dr. Vermont, about her experiences of her participation in the trial. And then I have a list of some what we call the FAQs, the frequently asked questions, that I'll go through and answer. And we'll have plenty of time for any additional questions that come up. And if we don't have the answers, we'll do our best to find them and get back to you. So this Kristen Panthagani is a scientist who decided to review the pros and cons of either taking the vaccine or not taking the vaccine. So let's get into it. I think one of the first things is to see, can I actually make a YouTube video work in PowerPoint? So this is putting me into new areas, but let's give it a try and see where we go here. And then maybe give me a thumbs up if you can hear the audio. And if not, we can move on, but we'll give it a shot here. No pun intended.
What is up? And welcome to A Scientist Looks at the COVID Vaccine Data by yours truly, Dr. Panthagani. So a couple of months ago, I was chatting with my mom about all the vaccine stuff. So, it was going really fast and all the new science. And at the end of our conversation, she asked me, so do you think you're going to take it? And at this point, nothing had been approved. And so my answer was, well, I'm going to look at the data, and that's how I'm going to make the decision. So that's what this video is. It's a look at the data, specifically the data on the Pfizer vaccine, which was published on December 10th in the New England Journal of Medicine. All right, so before we get into the data, just a little bit about how these mRNA vaccines work. So they're in these things called lipid nanoparticles, which is just a tiny droplet of fat. And there is mRNA inside, and that mRNA is instructions to make the COVID spike protein. So once it's injected, then the cell is like, hey, cool, yeah, I'll take you in. And then the mRNA goes inside and it meets up with the cell's ribosome. And ribosomes, all they do all day long is read mRNA and make proteins. So that's what it does. It takes that mRNA and it makes the COVID spike protein. And then from there, through some cool instructions, the COVID spike protein makes its way to the surface of the cell. And then the immune system comes by and is like, hey, who are you? You don't belong here. I'm going to make some antibodies against you. And that is how you form an immune response. So one very important note is that there's no actual virus in the vaccine. So it's just one piece of the virus. It's not the whole thing. So it's impossible to get COVID from the vaccine. All right, so now who was in the study? So it was a giant international study, people from all over the world, and people were ages 16 and older. So there was a total of 37,706 people. And people were randomized into either the vaccine group, which there was like 18,000 in that group, or the placebo group, which is just a saline injection. And there were again 18,000 in that group. And one important thing to know is that this study was blinded. So people had no idea which group they were in. So then what did they do? So they gave people 2 injections. So one at the beginning of the study and then one again 3 weeks later. And then they tracked them for both safety. So these were things like mild side effects, like pain at the injection site, things like that, or more serious side effects. They basically tracked everything that happened to their health during the course of the study. And then they also tracked efficacy. So does the vaccine work? And they did that by tracking people for COVID symptoms. So they asked them to report any COVID symptoms. And if they were having symptoms, then they took a COVID test. And if they were positive, that counted as a COVID infection. So one important thing to realize is that we didn't actually give people COVID in the study. It's not like we randomized them and then are like, okay, breathe in this COVID, good luck. No, that's unethical. Don't do that to people. So instead, what they did is they let people just live their lives, and then people got exposed in the community. Now, before we get to the data, it's important not to get these 2 comparisons confused. So the first comparison is comparing the mRNA vaccine versus placebo. And that's what we do when we want to know what is the true effect of the vaccine. So what are true vaccine side effects? However, when you're trying to decide whether or not to get vaccinated, you can't just focus on mRNA versus placebo. Instead, you have to take into account the disease that the vaccine is protecting against. And so then you want to compare, do the benefits of the vaccine outweigh the risks? So now we're going to get to some graphs. And if you hate math, don't freak out. I'm going to walk you through it. So were there side effects of the vaccine? The answer is yes. So in this graph, the green bars are people who got the vaccine and gray are people who got placebo. The height is how many people reported each side effect. Now remember that the people didn't know which group they were in, so they were just telling us how they were feeling that day and had no idea whether or not they'd even gotten the vaccine. If the 2 bars are the same height, that means people just happen to have headaches that day and it has nothing really to do with the vaccine. But if the green bar is significantly higher than the gray bar, then that shows that the vaccine actually caused that side effect. And that's what we see. So things like pain at the injection site, fatigue, headache, muscle pain, fever, as well as chills and joint pain. Those are all true side effects of the vaccine. More people experience side effects after the 2nd dose compared to the 1st dose, and the vast majority rated their side effects as mild or moderate. So what does mild or moderate actually mean? So to answer that, let's just look at one of the side effects, fatigue. So most people rated their fatigue as either mild, which meant it didn't interfere with their daily activity at all, or moderate, which meant that it interfered a bit with their daily activity. Maybe they weren't quite as productive as they normally were. A very small percentage said their fatigue was severe, which means it prevented their daily activity. Maybe they had to take the day off work. So how long did these side effects last? Thankfully, for most people, they only lasted a day or so and then went away. So then are the vaccine side effects basically like getting COVID? Well, no. So some of the names of the side effects, yes, are the same, like fatigue, headache, muscle aches, fever, chills, things like that. However, COVID causes more symptoms. It causes cough, difficulty breathing, loss of taste and smell, sore throat. But more important than that is the severity of the symptoms. So the vaccine side effects are something called reactogenicity. They only last 1 to 2 days, are mild to moderate, and they're actually a sign that the immune system is responding. Now contrast that with COVID. If you talk with people who've had COVID, they'll say things like, that was the most sick I've ever been in my life. The symptoms last weeks to months. Many require hospitalization and 1% die. So these are very, very different things. Now, what about serious adverse events? So in vaccine studies, they track all serious adverse events, which are any bad health thing that happens during the study, like if somebody's hospitalized, something life-threatening or causing long-term disability or death happens. And importantly, they track absolutely everything that happened to everyone during the course of the study. So most are not necessarily related to the study. And just like with the mild side effects, the way to interpret this graph is to see if the green bar is higher than the gray bar. And thankfully, they're pretty much the same, meaning the rate of adverse events wasn't any higher in the vaccine group than what we would expect just from normal life and life happening. But to be extra careful, they went back and looked at the details of all those adverse events and found that most had nothing to do with the study. It was just life happening. They did find 2 things that were maybe related to the vaccine, and those were swollen lymph nodes and a shoulder injury, but they were thankfully super rare. Now, what about the most serious adverse event, death? They actually found fewer deaths in the vaccine group than the placebo group. There was 4 deaths in the placebo group and 2 in the vaccine group. None of them had anything to do with the study. So you have to remember that when you're studying like 40,000 people over several months, like they were doing in this study, there's a reasonable chance a few people will die during that period just from other causes. So the risk of death from the vaccine is super, super low. Now, some people have argued that instead of getting immunity from the vaccine, we should let people get natural immunity by getting COVID, arguing that COVID is less dangerous than the vaccine. But let's do the math on that and see if that argument holds up. If 21,600 people got COVID, which is how many people got the vaccine, how many would die? Let's use, to be conservative, an estimate of 0.5% death rate from COVID, which is a 99.5% survival. So if that many people got COVID and 99.5% survive, that would mean 108 people would die. That's way higher than the risk from the vaccine. So getting immunity from the vaccine is way, way, way safer than getting immunity from COVID. But does the vaccine work? So yes, the side effects, there's some, but they're pretty mild, but we're not going to take a vaccine, even if it has mild side effects, if it doesn't actually protect against the disease it's supposed to protect against. So to look at this, they counted up all the COVID cases that occurred at least 7 days after the second dose. And they waited just because it takes some time after the vaccine for the body to develop immunity. And when they looked, they found there were only 8 cases in the entire vaccine groups. Remember, that was thousands of people and only 8 COVID cases. Versus the placebo group, there was 162 cases. So this clearly shows that the vaccine was protecting people from getting COVID. And if you do the math, that comes out to 95% efficacy. So that means that 95 out of 100 people who get vaccinated will be protected from symptomatic COVID infection. Now, is there any protection after the first dose? To answer this, they tracked how soon after their first dose people got COVID infections. So in this graph, if the 2 lines are on top of each other, that suggests there's no immunity yet, as there's no difference between the placebo and the vaccine group. And that's what we see for the first 10 days or so. The lines are pretty much on top of each other. But then after 10 days, the gray line keeps going up, meaning the people in the placebo group kept getting infected. But the green line stays flat, meaning that people in the vaccine group, for the most part, were not getting infected. So this data clearly shows us that the vaccine works. So that's the data in the study. So it tells us a lot. It tells us that the side effect profile, yes, there are some side effects, but overall they're pretty mild. And it shows us that the vaccine protects very well from COVID infection. But there's some things the study didn't tell us. So we still have some remaining questions that the study didn't answer. The first big one is, does it prevent transmission? And the reason we don't know that is just because we haven't studied it yet. But there's a myth going around that the vaccines don't prevent transmission. And this is false. In reality, we just don't know yet because we haven't collected the data yet. But there's a very good chance that they will prevent transmission. And why is this important? So if the vaccines prevent asymptomatic infection and transmission, that means they can help us reach herd immunity. It's estimated that we'll need 60 to 80% of the population to have this immunity in order to stop the pandemic. Right now, we know that the vaccine protects against symptomatic infection, which is awesome because that will help keep people healthy and out of the hospital. But what we don't know is if the vaccine is preventing asymptomatic infections and transmission to other people. So this is why you're hearing people say that social distancing and wearing a mask are still important even after getting the vaccine. Now, second is, how long does immunity last? And so this we can answer by following the participants further. And then finally, we don't know, are there long-term side effects? So the median follow-up time was 2 months after the second dose in this published data. Now, longer follow-up is ongoing. So should we be worried about long-term side effects? So the first thing to know is we're going to keep monitoring for side effects even after FDA approval. And one way we do this is through the Vaccine Adverse Events Reporting System. Anyone can file a report to this system. You don't have to be a doctor. You can just go online to this website and anyone can file a report. And by collecting this information, researchers can watch for rare side effects that might occur that were too rare to be detected in the studies. And this is just one of several systems in place. Others include the Vaccine Safety Data Link and the Clinical Immunization Safety Assessment Project. Information gathered from all these systems are used to track ongoing safety of vaccines, even after they're approved. But one thing I wanted to know is, how common are long-term side effects for other vaccines? So to look at this, I went to that Vaccine Adverse Events Reporting System and I downloaded all the reports that were made in 2019. Now, keep in mind, these reports aren't verified yet, so it's unknown whether or not the vaccine actually caused them, but anyone can file a report. And I found that of all the reports, 98% of people said that the thing that they thought was a vaccine reaction occurred within 2 months of getting the vaccine. And only 2% occurred more than 2 months later. So this tells me that at least for other vaccines, when people are concerned about reactions, most of them are occurring within 2 months of vaccination. And so if that's the case, that means our study would have picked those up. So overall, this makes me feel more confident that any long-term side effects are likely going to be pretty rare. So with all that said, will I take the vaccine? So it's a balance between the risks of the vaccine, which include possibly a day or two of feeling crummy, very low risk of serious side effects, and long-term side effects that are not known but no concerning data so far, and the risks of COVID-19. So those are 1% die, many more are hospitalized, mild cases can last for weeks, and there are known significant long-term side effects like long haulers. So when I'm making this decision, I can't only look at the risks of the vaccine, because yes, there are some, but I have to take into account that if I get this vaccine, I am drastically reducing my risk of getting COVID. So yes, there are side effects and some things we still don't know about the vaccine. But remember, that's also true of COVID. And what we do know about COVID so far has shown that it's way, way, way worse. So doing the odds, I'd way rather take on the small risk of getting the vaccine versus taking on the much larger risk of getting COVID if I don't get vaccinated. All right, folks, that's all I've got for you. If you'd like to see more content like this, follow my blog at youcanthnowthings.com or follow us on Facebook or Twitter. And finally, I'd like to throw a special shout out to my niece. Thank you for letting me borrow your markers this weekend.
Get the family thing going in there. That's pretty good. So I have to say, I I think it was quite impressive, and I hope you enjoyed the video. I think it covered a lot of ground there and put things into perspective. And I think, yes, it was technical, but really, and we'll go back over some of the points that were made during the video, but I hope you'll enjoy it. I'll have the website available at the end, and I think it's a reasonable thing to distribute it from that standpoint. Let's move to our next part. And I want to, what I'll do is first introduce Dr. Vermont, but then I'm going to back away from the PowerPoint presentation and hand the screen back, Jen. I think that makes sense. So when Dr. Vermont talks, she can be seen, if you're okay with that, Sharon. So
yeah, that's fine.
Right. So Dr. Vermont, we're very, very pleased and happy for you to participate your time in a busy practice day. I'm a pediatrician with a practice in Mercy Hospital St. Louis system, but certainly assists and helps us evaluate transgender youth and young adults at our transgender center clinic at St. Louis Children's Hospital. She obviously is just very, very interested in this area and helping out, and has a story to tell about her participation in the Moderna COVID trial. So I'm going to stop the screen share and give it up to you, Dr. Vermont.
All right, thank you. So being a pediatrician, I deal with vaccines every single day, multiple times a day. I mean, we give thousands of vaccines, to hundreds and thousands of patients in our office every single year. So vaccines to me are something that, I am very involved with, and that I have always felt are very important because, as I tell patients in my office who are hesitant about giving vaccines to their children, I tell them that vaccines are much safer in general than the diseases that they're preventing. And the reason that we often nowadays don't realize this is because so many of the diseases that we vaccinate young children against are diseases that we don't see anymore because the vaccines are working, right? So we don't tend to see polio. We barely see measles except for the occasional outbreak. We don't see mumps. There's so many diseases that we, protect folks against now, but the diseases are just gone. And so we forget sometimes that we're really saving lives through vaccination. And the COVID pandemic is really no different. So being someone who deals with vaccines all the time, when the pandemic started, I thought, gosh, I cannot wait until a vaccine comes out. And then last March, right before the whole shutdown occurred, I was watching the news and I saw them doing a story about the very first human being on the planet to get the Moderna COVID-19 vaccine. They were filming it as she got it. She was one of 45 participants in Seattle who were in the Moderna vaccine. And I thought, wow, that's really scary to be the first person ever to get a new vaccine. But gosh, if they have a trial in St. Louis, I am totally getting in that trial because we need to get rid of this disease. This pandemic is going to be terrible. And so Moderna had 45 initial participants in their phase 1 trial. And in the phase 1 trial, they were, checking to see, number one, is this vaccine safe? Is it effective? And what dose do you even need to give to make it effective? So the 45 participants in Seattle who were in the very first phase 1 trial were divided into 3 groups. A third got a lower dose, a third got a medium dose, and a third got a very high dose of the vaccine. And what they found was that the low dose wasn't probably effective enough. The high dose caused a lot of people to feel really sick. There were no life-threatening side effects, but especially after the second dose of the high dose, people felt pretty cruddy with high fevers and muscle aches and things for a few days. But that medium dose was both effective and much better tolerated. And so after that group of 45, Moderna said, all right, now we know our dose. It looks effective. It looks safe. So now we go on to phase 2 trials. And so the phase 2 trial, they expanded into, I think it was several hundred or a couple thousand participants. Again, finding the vaccine to be safe. So then eventually Moderna and Pfizer both opened up their phase 3 trial. And phase 3 trials are when They basically opened the trial up to the general population. They tried to get thousands of people vaccinated to really make sure that once you have a large number of people receiving this vaccine, that they're still able to show that the vaccine is safe and effective. And as soon as I heard that there were some sites here in St. Louis, I thought, this is my chance. So what I did was actually something similar to what the woman in this video did. I looked online and found the paper that was written and published from the Moderna phase 1 trial, because I did not want to go into this, completely blind. So I read the very detailed scientific paper from the phase 1 trial and realized, wow, this appears to be safe. This appears to be effective. Sign me up. And so I called and was accepted into the trial. And it was a little nerve-wracking because when you go for the first time, you're getting a shot, but you don't know if you're getting placebo or you're getting the vaccine. And I just kept praying, please let me have side effects, because I thought if I have side effects, then that's sort of some good news that tells me maybe I got the real thing. Because not only did I want to contribute to science, but I also wanted to be protected, because as a physician, I see patients every day. And even though in my personal life, I've pretty much stayed home for most of the past year, at work, even though I mask, and now I'm starting to double mask because of the new strains, I am around people all day long. So I wanted to be protected. So I went in, I got the first shot, and they asked a ton of questions. They drew blood. They did a nasal swab to test me to make sure I didn't have COVID at the time. And I went home that night and I actually felt a little achy, a little tired, but I was still able to go to the gym the next day. Although 2 days later, I went to the gym and couldn't do my entire workout. So I thought, maybe this really is the real thing. My arm was a little sore. And then after 48 hours, I was completely back to normal. A month later, they had me come back because the Moderna vaccine is 2 doses, 4 weeks apart. And I got the second dose. And again, I thought, please let this be the real thing. And they drew blood and they tested me with the nasal swab again, and they gave me my second dose. And about 6 hours after I got home, I started feeling really tired and achy. That night, I ran 102 fever and had chills all through the night. So I took some Tylenol and ibuprofen. The next day, I still had fever off and on and was pretty sick. But I have to tell you, I've never been so happy in my life to be sick, because I thought saline could never do this. I must have gotten the real thing. And so after close to 40 or 48 hours, I was back to my normal self. I didn't change anything in terms of my practices. I still distanced and masked and everything, but I felt like I probably did get the real thing, which made me feel a little safer. I've had several follow-ups since. Every follow-up, they draw blood. They do another nasal swab to test for COVID to make sure that I haven't gotten COVID in the interim. And eventually, when the vaccine was approved for emergency use for medical providers, I had to know if I had the real vaccine or not, because I either had to get the vaccine here at Mercy where I work, or I needed to not get it because I'd already received it. So Moderna did eventually unblind me, meaning they went into my file and they found out that yes, indeed, I had gotten the real vaccine. But I'm still in the study, and they're continuing the study right now for 25 months, although I suppose they could always extend that. One of the things they're doing at every visit, and I go every few months for lab work and things, and they call me every month to make sure that I'm doing well. Every time they draw blood, they're checking antibodies. So they're checking to see how long the antibodies last from the vaccine. And then eventually, if they notice that in a variety of, or a large percentage of people, that those antibodies are waning, then at some point they will probably make a recommendation that, yes, you need a booster. Maybe we will need to get a shot once a year. If they find that the vaccine produces antibodies that last for years and years, maybe it'll be like a tetanus shot and you only get a booster every 10 years. But that is up in the air right now. They're still trying to figure out, what that sweet spot is between, allowing you to go a long time without a shot, but making sure that your antibodies are lasting for a long time and that they're still protective. So I'm glad I was in the study. I'm glad that I helped contribute a small part to this vaccine that is going to be life-changing and help end the pandemic eventually. And I'm glad to know that people are starting to get protected. I definitely recommend getting this vaccine because I've done my research. I've read the scientific studies. I'm involved with the trial, and I can tell you that unless you have some medical issue where your doctor says, I don't think you're a candidate for this vaccine, then I think everybody else should get it. It's the only way out of the pandemic. And again, if you have muscle aches or fever for a day or two, it's much better than dying from COVID or getting COVID and spreading it to somebody else who could then later die of COVID. So that is my story, and I am happy to pass this back to Dr. Carr.
Dr. Vermont, thank you so much for your time and also for your volunteerism and jumping in to do the trial as busy as you are. I think it was great that you got in there, and you were probably betting based on your side effects that this has got to be it, because if this was a placebo.
Absolutely. Well, and actually at one visit, I said to the woman who was, there working with me, I said, I know that I'm still blinded, but I guarantee you I got the real thing because of my side effects. And she said, no, don't tell me that. You're not supposed to even try to unblind yourself. You have to go in with an open mind. I said, all right, fine. I know nothing.
Well, that's just great. And thank you for that personal testimony.
And I'll stick around. I can stick around for the rest of the event. So if there's any questions for me, I can certainly answer them later. So
that would be great. Well, I'm going to get on to the next section, and which will cover a lot of what I would call the frequently asked questions. And as you may know right now, at least in Missouri, we're finally opening things up to what we kind of call the tier 2. We've had the long-term care facility residents and staff. Some of us are finding out in long-term care where near 100% of our residents or patients are taking it. Sometimes only 30 to 50% of the employees are signing up so far. So we still have a lot of work to do in long-term care for education and training, and to convince individuals that the benefits outweigh the risks. So the healthcare workers at Barnes Hospital and outpatient clinics, we've all been immunized, and many of the first responders, EMS, paramedics, and now we're getting into those over age 65 and those with comorbidities. So where to sign up? Some of you may, I suspect many of you already have and may have started getting your vaccine, or at least are on the list and can get it soon. My understanding there's, in addition to getting on the county or city websites and going through the online form and getting signed up, now some of the health systems, BJH and BJC, Mercy, are having their websites available where you can also do some sign-ins and to get vaccine. I know there's a lot of I don't know if fuss or negativity is the right word, but people saying, oh, this distribution plan is a mess. But Dr. Vermont will probably join me. It wasn't that long ago, a few months ago, people were coming up to us and say, well, I probably won't get a vaccine until summer or something like that. And I'm sure for some parts of the population, it could take some time, but it is getting rolled out, and there's going to be more vaccine on the way. And personally, I've got a couple of children that work in the public schools, and one of them already got their injection this week. So we hope that more and more people will obviously have it done. So I've got a few slides just on some questions that typically come up. I don't mean to steal anybody's thunder. Myra and Michelle have already popped me a few questions in the chat zone, and I do think I cover those in these, but we certainly can expand upon that in a little bit. We already heard from our video on how the vaccines work by a small part of the genetic machinery, the messenger RNA, if you will, and it's taken up by the cells. So I think we've covered that. The efficacy, we also had a nice discussion on, and 95%. It looks like one of the other vaccines to follow isn't quite at that level, but I think that was a little surprising for these new technology genes, for them to both to be that positive for a reduction. 95%, I think, is important. And as pointed out, we really don't know how long they're going to work. So far, some of the data suggests that antibody titers are staying up pretty high for about 4 months, and then they're starting to come down a little bit in some of the post antibody longitudinal follow-ups. but that doesn't necessarily mean you're losing efficacy. And some people have said you could almost have 1/10 of the response and still, we just don't know, as Dr. Vermont said, time will tell. But some people do envision, and I'll get into some of the other strains that people are kind of concerned about a little later in some of the questions. But it may be that we need a booster at some point, and that could be added on to our flu vaccine or another setting. So short-term safety, we covered those, I think, in the video pretty good, and Dr. Vermont's personal testimony. The CDC does not recommend you pre-medicate with Tylenol or Advil. There's a theoretical concern if you took a lot of medicine beforehand, you might blunt the response. That's probably more theoretical than practical. But everybody recommends, you know, if you do have the fever, chills, et cetera, either Tylenol or the anti-inflammatories like Advil can be given. And again, they're usually short limited, 1 to 2 days. We don't know about long-term safety, but similar to the vaccine and what you can read online, there's very few vaccines that in the history of all the vaccines that we have had that have really shown to have, you know, long-term side effects. And most of them are ruled out by population-based studies. There's always been concerned about aluminum salts and mercury and things. And pretty much those have been debunked. But that's not to say there could be a rare side effect. And that's why I think it's important. We'll talk about another reporting mechanism. If you take it and something comes up, we've got to learn and find out over time. So the vaccines are similar that's available to us right now, Pfizer and Moderna, but there's a little bit of differences. I believe Pfizer was studied on a little younger population, 16 and up, where Moderna's 18 and over. And Pfizer's a little trickier for storage. You have to have cooler temperatures. I think once you bring it out of the deep freeze, it may only last maybe 4 or 5 days and you've got to use it. Where the Moderna vaccine, my understanding is you got to keep it at low temperature, but you can move it over to the fridge and it may last up to 30 days. And so there may be a little more wiggle room from that standpoint. But other than that, I'm not really aware of any major differences in the two vaccines. And I wouldn't say, oh, I need to wait for one or the other. I think whatever one you have available is probably reasonable. So is there anybody who shouldn't have a vaccine? So, you know, there's no eggs, there's no other compounds. As our video said, there's lipids, there's this polyethylene glycol. So if you have an allergy to that, then you probably would not take the vaccine. And I'll come back to that issue of allergies and allergic reactions in just a little bit. Should immunocompromised patients receive the vaccine? And the CDC says yes. You know, if you have, you know, cancer, if you're on steroids, if you're getting chemotherapy, or you have an immune deficiency disease. Now, granted, a lot of people weren't studied, but some of those individuals that were immunocompromised were studied in both trials. And so those recommendations are there. So should pregnant or breastfeeding women receive the vaccine? Is there harm to the fetus? So this is an area we don't know. I mean, it's being studied now. So it is an unknown. I can only tell you what I've read, the experts. This geriatrician doesn't care for too many pregnant women, but theoretically, there should not, for this these two vaccines, there should not be a risk, given that they're small amounts of genetic material, and at least in some of the basic science studies with animals and mice, there doesn't appear to be any harm. And so I think the tendency is, if you're a healthcare worker and you're pregnant and you have a high risk of COVID, that may push you more direction to take it. On the other hand, if you're working out of home, you're relatively isolated, maybe you would decline. And that's a personal decision between you and the physician. I know a lot of national organizations, or at least a couple of them, gynecological obstetric organizations, have endorsed taking it. And so, but the reality is it's still early. I covered the question about acetaminophen and nonsteroidals. Take it if you get symptoms, but not before. So what is Vsaf? So there's an application I mentioned in the video. You can go online and fill out a form, but you can actually download a phone app where you can communicate with the CDC and put in if you have any side effects and things along those concerns. If things are severe, somebody may call you from the CDC, or if they're concerned or they have some questions. But that's another way to enter information and sort of to track. And a lot of organizations recommend that doctors recommend to their patients that they sign up with this app and fill things out from that standpoint. So should the vaccination be delayed if a patient has any symptoms or is actively ill? And one of the questions that also was asked about if you've had COVID, either before or in between your 2 injections, what do you do with your vaccine? So first off, most of the recommendations are if you have an acute illness, to get over it, resolve it, make sure you've had at least a few days without fever and symptoms are improving. You can take that out to a week or 10 days. There's nothing hard or fast there. The concern is that you're not going to have a side effect, but if you're fighting another infection, you may not mount an immune response. But there's a lot of people with chronic symptoms, chronic medical conditions, chronic cough and dyspnea. They shouldn't, just because they've got symptoms from chronic disease, delay in getting it from that standpoint. Now, what if you get COVID and now should you take the vaccine or not? The recommendations are that you, even if you've had COVID symptoms and tested positive, that you do consider the vaccine. And the reason for that is there are at least rare instances where people have been affected more than once with the disease. And so the question is, well, when? Well, it turns out it seems very unlikely. If you're going to be a rare case where you got COVID a second time, it doesn't seem to occur within a 90-day window. So if you got COVID and you're like, okay, my doctor still wants me to get the vaccine, some people would wait 3 months, assuming they've got immunity, and get it, but you don't have to. And in fact, many people that we vaccinated, I volunteered for our vaccine administration program at Barnes, had it within a month, had it within 2 months, because they're wanting to get their immunity and boosted right away. And I think if you get on and look at the recommendations, they mostly would say, 10 days after onset of illness, if you're immunocompetent, 20 days. But you don't have to reduce that time. But you should be safe if you decided to put it off for a couple of months from that standpoint. Should a patient who's diagnosed with COVID, shortly after they get their first vaccine, receive the second one? And the answer to that is yes, is that people still think you should go on and have that done. But again, after you've recovered. So if you got it very early, you may be recovered in enough time to go ahead and take your second shot. On the other hand, if maybe you got it a few days before your second vaccine, you would want to wait until you're recovered to have it from that standpoint. So things to think about. Another question we're asked a lot is, should we get antibody tests like Dr. Vermont did for her studies? And at least from what I can see right now, the recommendation is we just don't know enough about the antibody tests still to know how to interpret them, who's got infection, and what they mean. So those are still research antibody tests, if you will. So we're not routinely testing people after they get their vaccination. Another question that comes up is, if I get the vaccine, does that mean I'm going to test positive now? Absolutely not. These mRNAs will not affect testing. And if you are positive, it's not from the vaccine. I just want to assure people from that. So the ingredients, like we said, are pretty much fat products, ethylene glycol, to kind of help it get through the muscle system into the bloodstream. And there's supposed to be no charges at all for the vaccines. Now, vaccine providers can charge a administration fee. So depending on where you go, there may be a small charge for that. Some are waiving it, but nobody under the CARE or COVID Act should be turned away because of money. And if somebody showed up and said, I can't do the administration fee, then the vaccine providers have to give it. That's just the situation. It's the situation. You know, most facilities, the other question comes up, I was a little surprised because the flu is shot as mandatory at Barnes. And I kind of had this idea when we got our COVID vaccines that they would be mandatory. But because of the fast track to get the vaccines done and still some questions about efficacy, I think everybody was a little reluctant to go ahead and make it mandatory. Having said that, I do think eventually it will be for many hospital and first providers to have it. I've heard there's already some facilities that have taken that step. And I think we just need a little bit more time. Dr. Vermont, did you want to jump in here?
Yeah, I just wanted to add something. You mentioned that because of the fast track and everything that, you know, that they didn't make it mandatory. And I wanted to actually mention that. So a lot of people, and this may be something you're going to touch on, but a lot of people have said, well, I'm not getting that vaccine. They produced it way too quickly. There's no way it's safe. Well, first of all, we have data to prove that it's safe, as I mentioned, and Dr. Carr mentioned, and as that video did a great job of showing. But the other thing is, the reason that the Pfizer and Moderna vaccines were able to be produced so quickly is because this messenger RNA technology has been, they have been working with that technology for well over a decade. And so although the technology, this is the first time it's being used in an actual vaccine that has come to fruition, that technology is not actually new. And so it's very easy, if you're a scientist who knows what you're doing, apparently, to be able to tweak the actual messenger RNA that is in these vaccines to make it protect against the virus that you want to protect against. And so they were able to make this vaccine quickly because that technology already existed. So I don't want people to think that this was really fast tracked and they came up with this technology in a month and now we're getting a vaccine. This is actually something that's been in the works for well over a decade.
No, that's a great point. Thank you. And I'm gonna, one of the other questions comes up about quarantine and COVID, and you know, if you've been exposed, you should really finish your quarantine to make sure you're not getting an active infection before you jump in, obviously, to get your injections. But I think some people sort of thought, well, if I get my second shot and it takes a week to, 2 weeks to get that full immune, I can be out and about and I could be interacting and all that. And the answer, disappointingly, probably to some, is no. We still need to mask and social distance for reasons that we've already talked about. Is we still don't know about transmission. So it may reduce your risk of disease and the severity of the disease, but it doesn't mean you won't necessarily pass it on from an asymptomatic standpoint. So all those things are still going to be in place until we find out much more about the vaccine. So there was a question about a new variant strain, and of course you can get online and read about experts who say they're not worried, experts that say they're worried, and that sort of thing. I think the reality is, as we've seen with a lot of viruses, they can mutate, they can change. This is going to be something that the vaccine industry and scientists will just have to keep up with and monitor. My understanding, the strain in the UK, at least the vaccines that we have available to us right now still had a pretty brisk antibody response to it. The one in South America, not as much, but there was still some response. We don't know how to interpret that yet. So I think it's one of those things that we really, you can spend some time being concerned, but just know that the industry, pharma, is aware of it. They're going to continue to track it. And when and if, we need another booster, another type, we'll certainly get it in there. Just to run through, this is the rumor control from the St. Louis County website. And you can read through there. I'll just pick out a couple of my favorites. So far, they haven't seen Bell's palsy being a significant side effect. HIV, you're not going to get that from the COVID vaccine. I've had people come up to me worried that their DNA was going to be altered because of this virus, and there's just no evidence that that's the case, or it could do that. There's we talked about the ingredients. There's no tracking chips in the vaccine. And I'm not going to, I mean, people have different types of concerns and beliefs. I mean, these are all out there, but I just wanted to make sure you're aware, and you can still donate blood after getting the vaccine. So we know about Pfizer and Moderna. What else is out there? So I think the UK really got the AstraZeneca one going early on. It's been held up here a little bit because they had a little bit of a challenge where they had some differences in dosing in about 2,000 of their cohort. Apparently people got a half dose instead of a full dose, and the outcomes are a little bit different. So they have to go back and do another phase 3 trial, I think, before that may be front and center. But the bottom line is, and Johnson & Johnson, Novavax, and there are literally tens, if not 15, 20 other vaccines that are coming along. So I think, and they all have different mechanisms. Some use adenovirus from a chimpanzee or human, and it's just interesting, the different mechanisms, and I'm sure there'll be much to say about some of these others as we go on. For those that are interested, I can send Judith and Jen a copy of these slides, a PDF file, if you're interested in some of these websites from that standpoint. And we've got about 10 minutes left, and I may or may not have answered your questions, but why don't we just kind of open it up at this point, and we will see what is on your mind.
Can I make a comment here?
Please.
My name is Neil Dunsky. It so happened that I'm Dr. Vermont's father. And I volunteered also in the trial. And I volunteered for the Pfizer vaccine. And I got the first shot and I didn't have any reaction whatsoever. And 3 weeks later, on October the 14th, I got the second shot. And I did not have any reaction whatsoever. And I was convinced that I got the placebo. A few days ago, the research company unblinded me and told me that I got the actual vaccine. So each body, as you can see, react differently. And in my case, I did not have any reaction whatsoever. And if a few months after getting the vaccine, I still don't have any horns going up my head. So there are no side effects, at least that I can see, but I can assure everybody that vaccine is safe. And depending on how your body reacts to the flu vaccine, for example, my body does not react at all to the flu vaccine. I don't have any reaction, and neither did I have any reaction to the COVID-19 vaccine. So that's just for your information.
Thank you. Really appreciate you passing that along. Some great points. One question that came was, any thoughts on taking the vaccine after radioactive iodine treatment for cancer? And I think obviously you would need to defer to your radiation oncologist or therapist. Just reading online about some of the side effects with radioactive iodine treatment: dry mouth, sore throat, nausea, vomiting, diarrhea, fatigue. I mean, some of those sound like they could overlap with the COVID vaccine. So I think there would need to be some spacing, but I would be hesitant to make a specific recommendation for how much that spacing should be.
Dr. Carr, I think Steve Rudinsky has a question.
Yeah, hi, Dr. Carr, and hi, Sharon. I think I've known Sharon for just a few years.
Just a few.
Going back to maybe junior high school or something.
A long time. Good to see you.
But anyway, my son's at Northwell Hospital, and he was just recently told that the J&J vaccine, where you only need one shot, has been delayed because of manufacturing problems, and there may be a 1 to 2 month delay on the J&J one.
Oh.
I want you to know that here at WashU, we have one of the top virologists in the world, Michael Diamond, and he has developed a vaccine that you take through the nose. And he's going through clinical trials now. And with his, I think he has said that there's less side effects and it protects you because the virus a lot of times goes through the nose. So I just wanted people to be aware of what's going on here at WashU. And Michael Diamond, I suspect has gotten every award, but the Nobel Prize. And I suspect that one day he may get that also.
Thank you. I wouldn't be surprised. And a lot of different ways one could administer, and that would be a good one. Dr. Vermont, do you want to share the comment about the question that came up about the, do we have to use the same vaccine? Could you switch from a Pfizer to Moderna for your second dose?
Right. So yeah, there was a question asked on the chat here, if you can get, like, let's say Pfizer for dose 1 and then Moderna for dose 2. And the answer is that has not been studied. So the recommendations are to try as best as you can to get the same vaccine brand for both of your doses. However, there has been some talk that I've sort of read about, people saying, well, let's say you get the Pfizer vaccine and now there's a shortage and you can't get the Pfizer vaccine for dose number 2, but Moderna is available. The thought is, if there's no other option, go ahead and get the other vaccine for your second dose, but that has not been studied. So at this point, only do that in dire circumstances. It really is recommended to stick with the same vaccine. And there really is no benefit of one vaccine at this point over the other. So whichever you get, you know, if where you are going has Pfizer or they have Moderna, from everything I've read and everything I can tell, they're pretty equal at this point. So I think you can feel good with either vaccine.
Yeah, one thing I forgot to mention was severe allergic reactions like anaphylaxis when you get short of breath and that sort of thing. So any vaccine, any drug certainly has the potential to have anaphylaxis where lips can get swollen, you get short of breath, and it can be severe, but thankfully, a couple things. It's very rare. It's been estimated 1 out of 100,000 so far for a COVID vaccine. To put that in perspective, when you take penicillin, your chances of anaphylaxis are 1 in 5,000. So the vaccine's 1 in 100. So again, very rare. But as a backup, all the vaccine providers have medication there and available in the rare event somebody had a reaction. And so I don't want to emphasize that, but just to know that that is out there. But again, I don't think, and we vaccinate people that have had skin rashes and allergies and things like that. You may have to stay a little bit longer after your shot, maybe 30 minutes instead of 15. But again, everybody seems to have done really, really well. There was a question about a lump and a bruise after the first shot. And could it affect my response? And I would think if you had some sort of reaction and it stayed there, you wouldn't want to inject into the same site. I think you would certainly talk to your vaccine provider and they probably would switch to another arm. But I do think you have to be aware that if you do have some pain and discomfort, sometimes that can get a little worse with the second injection. You just have to be aware of that. But again, you've got Tylenol and Advil from that standpoint to kind of help things out.
And the other thing I would add to that, so these vaccines are given intramuscularly in the muscle. And so sometimes when you inject a needle into the muscle, you can have a little bit of bleeding and, not severe, but just a little bit. And so a little bit of bleeding in the muscle is probably what led to the lump and to the bruise. And so it's not dangerous at all. But I agree, I would inject into a different site just so you don't make that worse. But we see that a lot actually in our pediatric population with their vaccines. That is actually the most common side effects that we get phone calls about, is that kids have a lump either in their arm or leg in the site of the injection. And it's just a little, irritation and bleeding in the muscle.
Yeah. Another question is, why isn't moderate asthma not on the list of pre-existing conditions? And that's a great question. I would think certainly, and when you're looking at COVID and preventing things, that would be certainly a consideration, and maybe it's more of a concern about severe, et cetera. But I I think that anybody with, heart lung disease certainly should consider it. There was a question about low dose prednisone and, any type of medication that has the potential to cause immunocompromise could theoretically put you at risk. Hard to know without the dose. Certainly confer with your doctor about whether to take it. But I think people that are on either low, moderate, or high dose prednisone should certainly consider having the vaccine.
And my hope from this forum is that all of you feel comfortable with what Dr. Carr and I are saying about the fact that these vaccines are very safe, and that you will go out into the community and tell your friends and your family and anybody that you're having conversations with that the vaccines are safe, that scientifically they've been proven to be safe and effective, and that really everybody should feel comfortable getting them, because unless a large percentage of the population gets these vaccines, we are going to be wearing masks and be in a partial shutdown for a really, really long time. And so the sooner that people get vaccines and the more that get them, the better off we'll be as a society.
Thank you, Dr. Vermont. Why don't we take one more question? And I think we've kind of reached the top of the hour here, and I can stick around for a little bit more, or maybe Dr. Vermont can too. But another question was about weight, and I'm just not aware of any weight contraindications to get the vaccine. I think, again, from the study trials, they were more based on age. Certainly, if you don't have, a lot of muscle mass, et cetera, there could be some pain there at the injection site. But I think that, again, I wouldn't let body weight prevent you from going on to get the vaccine.
No, and Pfizer is approved down to age 16. And I see this person said she only weighs 95 pounds. Trust me, there are a lot of 16-year-old girls that probably weigh 95 pounds or even less. And that should not be a contraindication.
There's one more question.
I have a question.
Yeah, I'm sorry.
Can I ask a question?
Yes.
I just wondered, the mercury, do any of those, I understand that neither of those vaccines have the ingredient mercury in it. Has that been confirmed yet? Because I noticed it was questionable on your chart.
I'm sorry, what was the question again? It was about mercury?
Right. Is that in any of the vaccines?
No,
right now?
No, I'm sorry if I made that, but no aluminum, no mercury.
Marcia had one other question. I'm sorry. There was a question in the chat. Why do they talk about people at risk to receive the vaccine that have type 2 diabetes? Wouldn't type 1 be a person of greater risk?
It's a great point. And I think my understanding is they're not so much in type 1, aren't so much an increased risk, but they are at increased risk for severity of illness. And for some reason, I know the CDC has made it a little bit less of a priority, but I still think it would be a concern. Still would recommend somebody go forward and have the vaccination. Dr. Vermont, do you have anything to add to that? Or?
No, I actually have wondered the same thing. I think diabetes in general, it puts you at high risk. So I don't know why they say that, but I would say both would make you at high risk.
Yeah.
Do we have any other questions? I think that was...
Dr. Vermont, Vermont, if you were in high school with Steve Radinsky, you must have been 2 years old.
I was not in high school with Steve Radinsky. I was in school with his daughter.
Now it makes sense.
But Dr. Radinsky and I are both very young.
All good.
I think that would wrap it up. Thank you, Dr. Carr. Jen, do you have anything else you want to say?
Let's say thank you, everyone, for coming. This was a fabulous program, and I want to extend our thanks to Dr. Carr and Dr. Vermont. I think this was wonderful. So thank you very much for collaborating on this project.
Yes, thank you, Dr. Vermont.
Was great.
Thank you.
You're welcome.
Appreciate it. Lots of fun.
Thank you.
Okay, bye, everyone.
Bye.